So immunotherapy is clearly effective in cancers that already generate an immune response. So melanoma, for example, has long been known to generate an immune response, and then when you add checkpoint inhibitors, which essentially unleash that immune response even further, we do see a clear benefit. And in triple-negative cancers, those are the ones that seem to be most immunogenic. And we've known that for years because these patients, when you operate on them, many of them have a lot of lymphocytes around the tumor suggesting an immune reaction. And it's those patients that actually have a better outcome to standard therapy, to chemotherapy. So that's going to be a group that is looked at first, is this group of patients, because we think they are the most immunogenic. The other group that may also be immunogenic are the HER2 positive ones. HER2 positive cancers can also have lymphocytic infiltrates, and those patients seem to do better with standard anti-HER2 therapy as well. In fact, they do well with chemo alone. There was one study that showed that they almost did as well as the patients that got Herceptin along with chemotherapy in a large randomized trial. It was one of the older trials that compared chemo alone to chemo plus Herceptin. And in the group of patients that had a lymphocytic infiltrate, their outcome with just chemo alone was as good as the group that got Herceptin. So that's another group of patients where immune therapy is going to be looked at. Now, the majority of cases are in fact ER positive and HER2 negative, and those appear to be the least immunogenic, but we're not sure yet, and we need to really include those patients in trials, and maybe not just straight up immunotherapy with the checkpoint inhibitors, but some of the newer drugs that stimulate the immune system, like the toll-like receptor agonists and OX40 and a variety of other parts of the immune activating pathways can be used in combination with some of these checkpoint inhibitors. So this is an area that's going to need more study.